Human urinary system. We're going to go ahead and start with the easy ones. We're going to do the kidney. Right here inside, we have a kidney. We have a ureter. And we have a bladder. Passes into the bladder right there. And then, of course, we'll do the blow-up. Make the huge monster picture of the kidney. Check it out. Got a kidney. Kidney's got a few parts that we worry about. First part we worry about, cortex, outer layer. Medulla is the inner layer that contains the pyramids. These are the pyramids. Note they're triangle shaped. Now, these dump into calyxes, little white things that drain into the renal pelvis. While we're sitting here in the pelvis, we'll notice that there's a renal artery, renal vein. And we'll talk about the smaller parts of the kidney. First thing we're going to talk about, renal corpuscle. This is a massively blown up one. This is microscopic, and it has a afferent arteriole going in, passing blood into the capillaries. The capillaries then filter out, send fluid down into the renal corpuscle, which then drains into the tube, which forms the nephron. And then, of course, efferent arteriole coming out. So glomerular capsule inside here. Glomerulus, this collection of capillaries, and then, of course, the renal corpuscle here. Now we're going to blow up to the really microscopic model of this. Here it is, purple thing. Looks right here. Actually, we'll use this one because this one's a better, easier one to describe. Here's our renal corpuscle. This is a nephron. This whole thing is a nephron. It's the primary unit inside the kidney. And first thing leaving the corpuscle is a convoluted tubule. This thing weaves back and forth, back and forth, back and forth. And then it hits the loop Henle, which dips down into the medulla and back up. Loop Henle, it's got two parts, descending, ascending loop. It's descending loop Henle, ascending loop Henle. Comes back up, distal convoluted tubule. Nope, we had a proximal, we now have a distal. Dumps into a collecting duct. And so those are the parts of the human urinary system. And while we're talking about parts of things, we'll talk about other parts. Male reproductive system. Those parts. Okay, first of all, testes, epididymis, ductus deferens, vas deferens. Goes up here, weaves up here, dumps in here. Well, weaves up through here, goes in there. And as it weaves up in the spermatic cord. Check this out. The spermatic cord, it can spin, twist, pinch things off. But we're going to continue back over here to this diagram. While we're there, we have seminal vesicle, little pink thing coming in here. Combines ductus deferens to make the ejaculatory duct. And then we have our prostate. Then we have a urethra. We have a prostatic urethra, membranous urethra, spongy urethra. Dumps out at the exterior urethral orifice. And let's see what else is on my list I want to cover. Okay, those are the main parts there. We're going to talk about the corpus callosum, corpus spongiosum, and the easy way to do it is to look at it from cross view. We've got corpus cavernosa. These ones fill with blood during an erection. Corpus spongiosum, that surrounds the urethra. There's urethra. And those are the parts of the male reproductive system.